everyone. Welcome back to The Dish. All right, it's time to talk about a topic that most people shy away from. So this is Awareness with Anna, and I'm sitting with Dr. Whitfield from Acute Surgical Care. Thank you so much for being here.
Thank you. It's my pleasure.
So listen, this isn't a topic that's easily talked about because it's personal, but we have to talk about it. So let's get right to it. So tell us about what you do at Acute Surgical Care first.
Well, I'm a colorectal surgeon. I did training in general surgery, and I provide general surgery care as well, but my specialty and area of primary interest is colorectal surgery.
Okay.
That encompasses everything from colon problems like colon cancer and diverticulitis, all the way through to benign anal rectal problems like hemorrhoids, fissures, things that make people pretty uncomfortable and have a hard time enjoying life.
Well, physically uncomfortable and mentally uncomfortable and emotionally, I think it's just, like we said, it's difficult for people to share that because it's so personal. Nobody really wants to talk about that, but it's important that we do because I think that we can save some lives if we detect and we are advocates for this kind of thing. So let's get into, how people can become aware if there is a problem.
Well, the thing that I would really want people to take home is with colon cancer screening, waiting until you think there is a problem is waiting too long.
Yeah.
And colon cancer is largely a silent disease. It doesn't present with symptoms until it's very advanced, until it's in its stage 3, maybe even stage 4 stage. So ideally you want to catch it early, and we do that with colon cancer screening, primarily with colonoscopies, but there are a variety of other screening techniques that we can talk about. But if you get screened at an early age and you have a problem and it's identified early, it's very treatable. 90% of colon cancers, when caught early, are curable.
Are cured. Wow.
Absolutely.
And this is something that he does. Dr. Whitfield sees all kinds of patients all the time when it comes to something like this. So it's important, you can feel comfortable coming to him to be able to sit down and talk about this because this is what you deal with on a regular basis.
It is, and people are uncomfortable in the office, especially when we have to do the exam, but I do it every day, and it's something that is really just part of my life at work. And everybody always makes a comment, say, I don't understand how you do that every day, but
somebody's got to do it.
It's part of what I do, and I enjoy it.
Yeah.
And with colon cancer screening, the risk starts really at age 50. It doubles every decade. There's higher risk populations. If you have a family history of polyps or cancers, you need to be getting screened earlier. And the best test really is a colonoscopy. And most cancers start as polyps. When we find those polyps, we can take them out and we can prevent someone from getting colon cancer.
Wow.
Colon cancer is pretty much the only cancer that we can actually prevent from occurring with a screening test. And I think that's pretty awesome.
Oh, it is. I mean, and some of the cancers don't even have screening tests, so the fact that you can do that with this cancer is amazing, and it could save a lot of people's lives. So what is the process of somebody new that's coming in to come see you? What can they expect?
Well, we would see them in the office. We would discuss things. If they're coming in for colon cancer screening, we talk about the different tests and why I think colonoscopy is the best. If they're coming in for another issue, then we talk about their problems and then do whatever component of the exam is appropriate.
And how often should somebody be screened?
That depends on their history. If you're an average risk individual and you have not got any family history of polyps or cancers, then roughly every 10 years if you're doing a colonoscopy. If you have advanced risk factors like a family history of cancer or polyps, it needs to be sooner, every 3 to 5 years.
Okay, so don't be shy. I know this is an uncomfortable topic to talk about sometimes, but it's important that you are aware and you are an advocate for yourself and your health.
Absolutely, and your family.
And your family, exactly. Well, thank you so much, Dr. Whitfield, for joining me. I know that we're going to be, you're going to be joining us in the future sometime to talk more about this, to go deeper into this subject. So thank you again for joining me.
Thank you.
All right, do not